After a foot injury last year, I was put in a boot for a couple of weeks. I've had tremendous SI pain. One of the things I tend to see is that when you've had an issue like a boot or a fracture or a big issue on one side, that other side has to do an awful lot of work to help you get around. Sometimes in that process, either with the original injury or just having to compensate for such a period of time. And boots, I'm telling you, if you're hypermobile and you have to wear a boot, that is so hard on your body. That uneven, if you can kind of find a shoe that sort of fits, that unevenness from wearing the boot is really tough, let alone the added weight on that side that you're having to struggle to drag that thing around. It is hard on backs, hips, SI joint issues. So if anyone is in a boot, is looking at getting a boot, or is unfortunate enough to need one in the future, keep that in mind. They are tough, and if you can get a scooter instead, that actually tends to work a little bit better. Sometimes I would almost take people on crutches over wandering around in a boot. I know, not great for shoulder and neck problems. I've been on them before. It is an issue. My first step is always look at your alignment. And sometimes if the problem or the injury is the foot or ankle, sometimes we forget to look all the way up to like your hip and your back. We're looking at that hip alignment, and this, your PT can help you check this, your chiropractor can help you, massage therapy, but you're looking to see, are your hip bones lined up? And the other thing I like to look at is, are your legs the same length? Because that gives us a clue in terms of, is your back lined up right? One of the ways you can check yourself is lying with your feet, kind of see here, straight out in front of you, and then lying straight back. And you can have a partner or someone check those hip bones to see, do they look straight, do they look off? And then the other part of it you can do is you can have somebody physically help you go from lying down to sitting in a long sit position, if you can tolerate this. Some people can't. If you can't, don't do it. But then looking to see, like, okay, are your feet lined up? Are they even? Are they off? Is one longer than the other? And if it is that one is longer than the other, that tends to be an issue with that SI joint pelvic alignment. So if you have that, the one thing I will show people in terms of correcting themselves is to do this resisted out and in. Several of you have probably seen this or done this before. The thing I like about it is it's safe, which means if you don't need to do it, like, it's not going to hurt you. And if it helps, great. So you can use a belt, wedge your legs against like two legs of a table or something like that, just something that's not going to move. You can also have a partner help you with this just by using their hands to hold you in place, not to squeeze you in, but just to kind of maintain that position. And then what you're going to do is you're going to push your knees out. I'm actually using a belt. This is actually a gait belt. It works quite well. There's no give to it. I've also done this at home with literally one of my own belts. So if that's what you have, that's going to work great. And you're going to hold for about a count of 8. Now, I would do that 2 or 3 times. Just make sure you get a good contraction through your hip muscles. If you're pushing with your feet, not what you're going for. You want a good contraction with those hip muscles on the outside. Then you're going to follow that with squeezing your knees together as hard as you can. You can use a towel, a pillow, a ball. You can use your hands and just squish. The big thing is you want that big contraction. And so if you're worried about hurting your hand or hurting something, that's not the right thing. Switch and get a towel or something you can really squeeze into. Sometimes you'll feel a pop in your groin or at that pubic bone, and it always feels like it should never pop there, but that's actually kind of what we're looking for. Now, if it doesn't pop, that doesn't mean it didn't work. That just means it didn't pop. You can stand up, move around, see if that helps your pain. And you can also try that lying back sit up movement again and see if that makes a difference, if your legs are closer to being the same length. Now, if your alignment is good, then sometimes that ongoing hip issue is you're still overusing that side. So even though you're better, your foot injury's healed, you're still using that same pattern. And a lot of times it's watching that hip, that you're not throwing that hip out and protecting that previously injured side. So you got to make sure that if my problem was on this right leg, that I'm not dropping and overusing that left hip to get around. The other thing is that you want to watch and make sure when you're just standing, not necessarily doing anything, washing dishes, washing your hands, cooking, that you're not overusing that left side, or at least for the purposes of my example, that left side, so that previously non-injured side is not taking the majority of your work during the day. Because sometimes it's tired of doing all the work and it needs a break. So you need to make sure that you get that even. A lot of times that is picked up in physical therapy and you work on strengthening. I'll have things show up weak very frequently. You want to look at that weakness where if you're doing strengthening exercises and it is not getting stronger, there is something that's causing that to not get stronger. It's not just you're not doing enough exercise, or maybe you're not quite doing the right exercise. Most of the time it's because you're either overusing it 90% of the day, the whole rest of the time, and it never gets a break to recover, or there's something else that is keeping it from doing that. So that SI piece, that alignment piece, that could be a why. A couple other things that can be whys are if you have abdominal adhesions. So this is for my endometriosis, polycystic ovarian syndrome, appendix removal people, C-sections. If you've got scar tissue in that lower abdomen, that can shut off your hips, and that affects your pelvic floor. Also, any of the bowel issues, your itises, your diverticulitis, colitis, those can affect the function of those hip muscles as well, which means you keep doing the exercises and your internal system is just shutting them off. So that can sometimes need to be addressed for that strength to come back. So that would be another thing that I would look at with trying to not overuse it, making sure that you're not taking too long of steps. Sometimes we'll do this asymmetrical, we're saying it's my right foot or ankle was injured. If that's not 100% and I'm still stiff on that side, sometimes I'll take shorter steps with my left and then really take longer steps when I'm moving across that right hip, so it's having to do a larger percentage of the work and the movement. So that restriction on that, the injured foot, can still be playing into that hip issue. Now I'm kind of assuming that within this question, the foot and ankle is doing well and it's more just a hip issue. Take a look at those things, because usually those are the things that get missed. The SI alignment, where they're focused on your foot and they're missing what's going on up above. Or do you have another existing condition that maybe not related to your foot, but is unfortunately playing into your ability to get better? Hopefully one of those two things will help.